most natural pharmaceutical medications.
Yeah, to make your body function like it was 10 years ago. Ooh, that sounds like a clickbait title in the making.
Yeah.
Yeah, they talk about things that are, not particularly effective here.
Mm-hmm.
So, a copper IUD. Again, I'm not surprised by that because it is a non-hormonal contraception. Copper IUD plus dutasteride would be an interesting stack.
It would be.
If you're looking at a woman who desires long-term contraception, doesn't want to alter hormone production, but wants to resolve the PMDD, and perhaps suffers from a bit of acne or hair loss, that could be, for a sort of niche patient, a very good option.
Yeah, a lot of my most functionally, naturally minded patients really like dutasteride when they have no desire to do any childbearing soon. Because if you think about it, it's altering an enzyme, and it's the ratio of the enzyme. So you can alter the dose of dutasteride depending on how estrogenic you want to shift things versus how androgenic you want to shift things. It increases your testosterone, so it actually might have a slight net benefit in body composition and burning body fat, the lipolysis benefit that you can get from it. And it also slightly increases estradiol as well. So it's kind of another benefit in some women.
An estrogen booster.
That you're suppressing estradiol of. Yeah, estrogen booster. So think of it as a fairly natural thing, just like I think of PDE5s as a fairly natural thing as well. Keeping PDE5 levels to that naturally rise over age to a fairly normal level. It's a bit of an aside. Maybe that's a good list that we can do in the future. Top 5 or top 10 most natural pharmaceutical medications.
Yeah, to make your body function like it was 10 years ago. Ooh, that sounds like a clickbait title in the making.
Yeah.
Danazol, this one was kind of surprising to me because it has so many different actions and targets. It's an androgen, it's an estrogen, it's a progestogen. I believe it even has some activity on mineralocorticoid receptors. But it was, not effective. It says it has not been tested. And again, it does carry a risk of VTE. There's probably better agents to be used there.
Yeah, I think this is what people used to call danazol, manazol. So not really used anymore.
Yeah, the risk of viralization for sure. Benzodiazepines, not recommended. Interestingly, I think there was a mouse paper I was looking at. Allopregnanolone is even more potent at, increasing GABA signaling than a benzodiazepine. I don't remember the specific one they were looking at, but it was something like a 10-fold difference. And it's not a direct agonist, it's a modulator of GABA signaling. So I thought that was interesting. Benzodiazepines sound like another good way to destabilize your GABA signaling during this time, especially if you have a particularly short-acting one.
Mm. The last one is bioidentical progesterone, or progestogens only without estrogens. This is kind of interesting, but they said basically no evidence or negative evidence. So you could make the case that it's proven that if you take bioidentical progesterone orally, it goes through first pass in the liver. You have a pretty high amount of conversion to progestogenic neurosteroids. So you could use this in concert with other things. By itself, it doesn't have great evidence, but there's a decent amount of patients that are on something serotonergic plus bioidentical progesterone, and they do quite well.
Yeah, or something to modulate cortisol, because you can't always avoid the stress in your life. So there are adaptogens out there that you can use to sort of push back against that stress to some degree. It's not 100% effective, but like everything else, it's a tool. So there's a lot of options. So looking at this, it's not like you have A or B or C or D all the way on. You can a lot of times use a little bit of a couple different things and get a much better side effect profile, much better benefit profile.